Let's start off with the unit Obsessive Compulsive Disorder. And this unit happens to be the fifth and the last unit when we try covering our syllabus for clinical psychology. There are 5 units that we have in total. There are 5 chapters that we have in total when it comes to clinical psychology, which was formerly known as abnormal psychology. It is just recent that they changed the name abnormal psychology to clinical psychology, with the units, that is the chapters, being the same. However, there are some differences in terms of the topics that were there. But this is something that keeps on happening and has happened before as well. So without any further ado, let's start off with having a look at the syllabus, rather say the first section of the unit or the first section of the chapter. Each unit, like I keep on mentioning, is divided into 3 sections. The first section always has to do with the diagnostic criteria for a particular mental illness. The second one has to do with the explanations or the causes to it. And the third one has to do with the treatment and the management techniques for a particular mental illness. Now, this particular sequence that I keep on referring to every now and then, about how they are the same sections. This stands true for all the 5 units or all the 5 different chapters that are part of a syllabus for clinical psychology. So let's begin. The name of the unit over here is Obsessive Compulsive Disorder. Obsessive Compulsive Disorder, this is seen by many as an anxiety disorder because there are obsessions, or in other words, reoccurring thoughts that lead to an individual feeling anxious. Now, if we talk about the breakup of this particular section, that is diagnostic criteria for obsessive compulsive disorders, initially we would be expected to know about the diagnostic criteria according to ICD-11 while focusing on types of obsessions and compulsions. This could be through different examples. I tried to give you all a couple of examples that would help you understand this better, followed by this study. That is an example study that was conducted by Rappaport on this 14-year-old young boy known as Charles. So I don't think it's written here. I'll just refer to this as an example study. Now, I have broken this particular section down into 3 parts. The first one being the diagnostic criteria for obsessive compulsive disorder. The second one having to do with the types of obsessions and compulsions. And the third one has to do with the study that was conducted by Rappaport in the year 1989 on this 14-year-old young boy known as Charles. This is what I plan on covering in today's lesson. However, in our lesson tomorrow, inshallah, we would be discussing the measures, that is MOCI, Maudsley Obsessive Compulsive Inventory, and Yale Brown Obsessive Compulsive Inventory, YBOCS. Now, a couple of relevant issues and debates that should never be ignored. And the relevant issues and debates and methodology for this topic include, okay, so you could use any other relevant issue and debate as well while answering any question, especially the evaluative question that you get in paper 3, that that follows the descriptive question. Now, the relevant issues, debates, and methodology that could be used for evaluation over here include: number 1, interviews; number 2, it could be case studies; number 3, it could be quantitative and qualitative data; followed by psychometric measures, followed by validity. Let's begin with obsessive compulsive disorder. What exactly is obsessive compulsive disorder? To be able to understand obsessive compulsive disorders, it is important that we know that we're supposed to break this term obsessive compulsive disorder into 2 parts: obsessions and compulsions. I'm sure everyone, even a common man, layman, would know that obsessive compulsive disorder is no, is or has to do with 2 different components, that is obsessions and compulsions. However, where I see many students make a mistake is them not exactly knowing what the term obsession over here in this particular context means, and how this term obsession is different from the term compulsion. When I use the word obsession here, or when we use the word obsession over here, obsession refers to the the persistent, the disturbing, the distracting, the demeaning, the discomforting, the intrusive, the unwanted thoughts, right? Now, the word obsession has to do with thoughts, right? If I use one keyword that would help you differentiate between the two, that is obsessions and compulsions. That word over here is thought. When we talk about obsessions, know that your obsessions are your thoughts. Now, what sort of thoughts are we talking about? We're talking about repetitive, persistent thoughts, repetitive, persistent thoughts, your images, your impulses, your urges. Now, these repetitive, unwanted, discomforting, disturbing, intrusive thoughts that we have, they're very unwanted. And imagine if I may give you an example over here. If I talk about myself, if there is something that is bothering me and it keeps on bothering me time and again, if I being a teacher, if I'm taking a class and I'm in the middle of a session and there's something that keeps on popping in my head every now and then, tuck 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 tuck, don't you think that particular unwanted, intrusive, persistent, repetitive thought might not let me focus? And if I'm losing focus, I wouldn't be able to perform my daily functions properly. That might consequently lead to me not being the way I am. And that might lead to a lot of anxiousness, that might cause anxiety, that might lead to my work being affected, my social life being affected, my friends being affected, and so on and so forth. So, obsessions, if you put it in a simple manner, your obsessions are your thoughts, your intrusive, unwanted, persistent, repetitive thoughts. And what sort of thoughts are these? These thoughts, because they're unwanted, because they're intrusive, because they're very persistent and repetitive, they usually lead to an individual feeling very anxious about them. Now, a typical reaction to this, a typical response to this could be trying to ignore them or maybe trying to suppress them. But guess what? This act of ignoring or this suppression doesn't always work, because, of course, we're talking about a mental illness. We're talking about an individual is a potential who's a potential patient to obsessive compulsive disorder. Now, in this case, we are talking about an individual who, despite of these obsessive thoughts, initially tries to maybe ignore them, maybe try to suppress them. However, if that does not work, the individual might end up trying to neutralize them. Now, another keyword that I'm trying to use over here is neutralizing that particular thought. Now, how is it that an individual who's a potential OCD tries to neutralize that act? That particular act of that particular thought is tried to be neutralized by acting upon it, or by acting or by performing a compulsion that helps that individual get over that thought, that helps that individual be able to neutralize that thought. Now, when we talk about compulsions here, I'd like to assume we all have understood what the word obsession over here means, and how I initially tried explaining what the word obsession means, and then I went on to discuss the idea of neutralizing, and we spoke about how and why this act of neutralizing that particular obsessive, unwanted, repetitive thought is important. Now, the act of neutralizing in itself, the act, right? Remember, when I'd use the word thought for obsession, the word want to use for compulsion over here is act, right? So your obsession has to do with your thought, your I'm sorry, your compulsion has to do with the way you act. So compulsions are repetitive behaviors, including repetitive mental acts that the individual feels driven to perform in response to an obsession. Remember, we're talking about an individual who is being continuously, constantly, repetitively, persistently disturbed through these obsessions, through these obsessional thoughts. Now, this particular individual would try to neutralize those obsessional thoughts by acting on them, or acting accordingly. Now, this act, which is actually a response to that obsession, might include very rigid rules, which might make that individual feel a sense of completeness, make might help that individual feel less anxious. So, to be able to get over that anxiety, to be able to get over that anxiousness, an individual starts acting accordingly, which is in this case and context referred to as compulsion. So your obsessions are your thought, your compulsions are when you're acting according to that thought. Now, one more thing that I'd like bringing in under discussion over here, which should not be missed and ignored at all. When we talk about, let's just say, individual, Mr. XYZ. Now, do you know what this individual XYZ, as others see him, would be involved in that compulsive act. Now, what I'm trying to explain over here is your obsessions, since their thoughts, no one gets to see you, right? No one gets to rather see those thoughts. What individuals or what the people around you note is that act that you're performing. Imagine an individual that has these unwanted, repetitive, persistent thoughts of germ contamination. We're talking about Mr. XYZ, as I referred to him, and this particular individual feels anxious because this individual feels like he might be contaminated by germs. Now, this particular thought of germ contamination would keep on bothering this individual, would keep on disturbing this individual, would not allow this individual to perform his daily tasks, will not allow this individual to be able to do what he is supposed to do on a daily basis. Now, because you don't want your daily functioning to be affected, because you do not want that continuous, repetitive, persistent thought to bother you, in this case, what many individuals do is they start acting accordingly. They start getting involved into an act. But guess what? This act in itself is of a very cosmetic nature. This act in itself plays a very, rather say, temporary role over here, because the individual who might at that particular time feel complete, I mean, feel that completeness, might be able to avoid that anxiety, might be able to keep himself away from anxiousness, might not be able to, might not be able to yeah, might not be able to stay in calm for very long, right? It is just a matter of time that that particular thought would start bothering that individual again. So what I'm trying to explain over here is, because your thoughts are persistent, individuals are seen acting according to those, according acting up on them very regularly. Or you see an individual, if I stick to the example that I'd given earlier about this individual who feared germ contamination, you'd see him being involved into, let's just say, hand washing, a ritual of hand washing, which might be might be performed in a very rigid and a very ritualistic manner, in a very religious manner. So because people see you doing what you're doing, and because people do not or cannot see your thoughts, it is your compulsion that gains gathers a lot of unwanted attention. So we're talking about thoughts and how these thoughts that are your obsessions are different from your compulsions. Now, if we talk about the diagnostic criteria over here, now rather before that, I would want to give another example that I believe would help you understand this entire thing in a better manner. Now, for instance, what happens is, the example that I gave you a little while ago was about an individual who feared germ contamination, and this fear of germ contamination resulted in that particular individual having to wash his hands every now and then. Now, in this case, in this particular example that I just gave you, that particular thought you had and the act you performing, they go hand in hand. So your act, or your compulsive act rather, if I may put it that way, so that compulsive act is pretty much in line with your obsessions, right? However, it is also important for you to understand that not every compulsive act is in line with your obsessional thought. Now, what do I mean when I say what I said? I'd re-say that. Not every compulsive act goes hand in hand or is in line with that particular obsessional thought. Now, let's just say if I am someone who fears being, yeah, I'll just use an example from here. Let's just say if I am someone, if I talk about the second example, the one that you see over here written in, written with two harm fears. harm fears, if I'm someone who gets has these repetitive thoughts about accidentally or intentionally harming my own self or someone else. Now, that's the obsessional thought that I have. What if I start what if I start mentally counting numbers, right? Now, what if the act that I use to be able to get over that obsessional thought has to do with mentally counting numbers? Of course, if I'm doing that, that does not at all go with that, go in line with the obsessional thought that I had. So the point that I was trying to make over here is some compulsive acts go hand in hand with the obsessions, others do not. It is important that we understand this. Now, taking this ahead, if we move on towards the diagnostic criteria over here. In order for obsessive compulsive disorder to be diagnosed, obsessions and compulsions must be time consuming. The first thing that has to be kept in mind over here is these obsessions and compulsions must be time consuming. Number one. Number two, or rather say, let's use an example here, they must be taking more than an hour per day. So that's the first checkpoint. Number two, and results in significant distress or significant impairment in personal, family, social, educational, occupational, or other importance of or other important areas of functioning. So number one, consumes a lot of time. Number two, causes significant amount of distress, or it could have a significant impact, negative impact on your personal life, your family relationships, your social activities, your social relationships, your education attainment, your occupational performance, or for the matter of fact, any other important area of functioning. I hope this has been clear over here. Now, what I was trying to explain you since the last, I believe, what, 10-15 minutes has is written over here. And when we speak about these obsessions and compulsions, how is it that these obsessions are different from the compulsions? If I may say, your obsessions are your repetitive persistent thoughts, which might be irrational, which might be illogical. And when we talk about compulsions, your compulsions are when you are acting according to the when you're acting according to those obsessive thoughts. Now, your compulsions are acts that you get involved into, acts that you're performing, which might as well be ritualistic. You're performing these compulsive acts so that you're able to neutralize. The keyword that I'm using over here is neutralizing, so that you're able to neutralize that obsessional thought. Now, I think I was clear when I think I've been clear with this. I tried at least. Now, a couple of examples that would help us understand these obsessions, a couple of examples that would help us understand obsessions and help us know how obsessions are different from compulsions. Now, an example of obsession that we have over here, the example that I just gave you a couple of minutes ago, this example of germ contamination, or an individual who fears being contaminated due to germs. Germ contamination, as this reads, persistent thoughts about being contaminated by germs, dirt, or any harmful substance. Another example of obsessions over here would be harm fears, which I just read a couple of minutes ago. Repetitive thoughts about accidentally or intentionally harming oneself or other. Number three, the third obsession, symmetry or order, disturbing thoughts that cause extreme discomfort if objects are not aligned or arranged perfectly. Now, if I talk about these three examples that you all saw in front of you, do you see the word thought being highlighted over here? Do you see the thing that is common amongst all three of them is that thought? So for the 9,999th time, your obsessions are your thoughts, your persistent, unwanting, uh, delusional maybe thoughts. Now, moving on, if we talk about compulsions, compulsions are acts that we use to neutralize. Now, an example, a couple of examples. Remember, these examples that I'm giving, these are not the only examples. These are not the only compulsions and obsessions. There are many, many more that exist. But for now, for the sake of understanding and to be able to cater to that particular part of the syllabus, I have just catered to three. So if you talk about compulsions, yeah, an example of a compulsion over here could be cleaning and washing. There are individuals that we see who are who are excessively involved into hand washing or showering or cleaning of certain objects, and they do this to be able to eliminate their perceived threat of contamination. One, the second example could be that we could use over here could be checking, or in other words, repeatedly ensuring that the doors are locked, appliances are turned off. You're doing this because you're trying to avoid any sort of harm. Number three, arranging, that is organizing objects in a precise way to just feel right. Remember, to just feel right, or to avoid or to neutralize that negative thought that causes discomfort. Or instead of saying just feel right, we could use this term completeness over here to experience that sense of completeness, to be able to experience that sense of completeness. Now, I hope I was able to help you cover this part and to be able to cover this part. Without any further ado, let's quickly hop on to this example study. This example study that was conducted by Rappaport. Rappaport conducted this research in the year 1989 on this young boy known as Charles. Now, this study that was conducted by Rappaport conducted this research in the year 1989. Now, this particular example study that was conducted by Rappaport, you might as well want to take a screenshot of this. Rappaport conducted this case study. Now, this is a case study. When, of course, we're talking about a case study, we should be reminding ourselves, or we should know that there are certain pros and cons that are associated with a case study which are not to be ignored, sorry, which are associated with a case study which should not be ignored. So this case study conducted by Rappaport on this young boy who was 14 years old, known as Charles. Now, what was the, if we try to figure out the purpose behind this study, Rappaport was trying to examine obsessive compulsive disorder in children and how it impacted their day-to-day functioning. So this young boy, that is Charles, he feared germ contamination, to put it in the most simplistic of form. Now, this young boy, Charles, if we talk about his background, he showed obsessions about dirt and contamination. When I say he showed obsessions towards germ and contamination, what I mean is all he had, I mean, if it would be, it might not be correct if I say all he had in his mind, but most part of the day, he would be or he would have these intrusive, persistent, unwanted thoughts of thoughts that keep him disturbed, thoughts about dirt, thoughts about contamination. Now, if we talk about the background, this boy Charles, he showed obsession about dirt and contamination, to the point that he spent around 3+ hours showering per day, which include, I mean, which does not include 2 additional hours that he took for getting dressed. Imagine a young boy who's 14 years old who spends around 5 hours a day in these. Uh, I mean, I don't think it would be wrong to refer to these rituals as illogical, irrational, or I think the word maladaptive does better justice over here. So he had this very ritualistic, this boy had this very ritualistic routine about showering. When I use the word him having a ritualistic routine, what exactly do I mean? So this young boy, he would what do you call it, so he would hold the soap in one hand, and then he would put it under water. Then he would keep on switching his hands, and so on and so forth. So this was a very ritualistic way through which he was acting. He was acting in a man. He was acting, and he was acting in a manner that he could be able to get done with. He could be able to get through his obsessive thoughts. Now, Charles had been a very good student with a particular interest in science. He had to leave school because his washing rituals were making it impossible for him to attend on time. He had also been in and out of hospital for his condition, and he had already received standard treatment of medication, as well as behavioral therapy, as well as psychotherapy. Now, if I may add up to this part, and if I write treatments over here, if I add up to the treatments here, so number one, standardized. The first one over here is standardized medication. The second could be behavioral therapy. Now, despite of these initial treatments, rather say pre-Rappaport treatment, I'm just writing this so that you guys know what part am I referring to. So if we talk about these pre-Rappaport treatments, this young boy, he did receive standardized treatments that included medication, the use of medicine. There was behavioral therapy that was involved, as well as psychotherapy being involved. So, Charles was, however, still utterly obsessed with the thoughts that he had something sticky on his hand that had to be washed off. In an attempt to help her son overcome this worrying thought, his mother had helped him clean his room and kept things he touched clean with rubbing alcohol. So this isn't just disrupting the boy's routine, the boy's educational journey, but at the same time, this must be keeping the mother pretty occupied as well. He had only one friend because his ritual left him little time to leave the house. He underwent a drug trial of clomipramine. Let's just mention that here. That would make it easier for us to be able to keep a track. Now, this is a type of antidepressant which gave effective relief of his symptoms. He was able to pour honey, for instance. Yet, after a year, he had developed a tolerance for this medication. Now, after a year, this medicine did not quite work the way it did work initially. So, Charles developed tolerance towards this medicine. Tolerance towards this medicine, or in other words, the way this medicine used to work before it started reducing, the effect started reducing because probably his body or Charles himself had gotten used to it. Charles relapsed and returned to ritualistic washing and dressing all over again. So despite of these measures being taken, it was just a matter of time. It was just after a year. I might as well write this down. It was just after a year that the medicine's effect started reducing, which consequently led to a relapse. This consequently led to a relapse. What does the word relapse mean over here? In other words, you start experiencing the same symptoms like before, or in other words, for if we talk about this specific example, if we talk about Charles, he had started with his own very ritualistic routine of washing and dressing. Now, about this young boy Charles, we've spoken about the purpose, we've spoken about the background, we've spoken about his symptoms, we've spoken about how it impacted his life, we've spoken about the initial treatment, and Yeah, if we talk about the findings of this particular study, Rappaport highlighted how obsessive compulsive disorder can dominate a person's life when and interference with his or her day-to-day functioning. In particular, this study emphasized the biological underpinning of OCD and the effectiveness of medication in managing symptoms. Now, as we talk about this particular study, this is a part of our syllabus, and this happens to be an example study. And with this being covered, as initially planned, we were to cater to this one particular bullet from the section diagnostic criteria for obsessive compulsive disorder, which is a section that comes under the unit obsessive compulsive disorder, which is a unit that comes under the component clinical psychology. I hope this was helpful.